So thank you all for attending. Is this typical? Tonight we will be discussing child development for ages 1 and 2-year-olds. I'm going to have the therapists introduce themselves. My name is Brandy Plass. I am a physical therapist and I will be moderating tonight's presentation. We have a physical therapist, occupational therapist, and speech therapist on this as well. And I'm going to let them go ahead and introduce themselves now.
Hello, my name is Casey Finnan. I'm a physical therapist at the Cleveland Clinic Children's Hospital. I've been a physical therapist for 29 years and been working at the Cleveland Clinic Children's Hospital for 23 years.
Hi, my name is Haley Melachar. I'm an occupational therapist. I have been an occupational therapist for 5 years and with the clinic for 4 years.
Hi, my name is Melanie Karpus. I am a speech language pathologist at Cleveland Clinic Children's. I have been a pediatric SLP for 18 years, and I have worked for Cleveland Clinic Children's for 17 years.
Okie dokie. So really quick before we jump into the physical therapy portion, I just want to remind everyone that in this presentation, we will be talking about typical developmental milestones for 1 and 2 years old. It's always important to remember that these are guidelines. They are not hard limits, and sometimes kids will achieve these skills slightly before the age ranges we're discussing or slightly after. If you ever have questions, we always encourage you to discuss them with your pediatrician, and they can kind of guide you in the right direction. So we will go ahead and get started, and I will have Casey take it away with the physical therapy.
Okay. So, physical therapists look at gross motor skills. Our role is to observe movements and identify if there are any asymmetries, deficits, or delays. And we help with balance, strengthening coordination, motor planning, and educating families on how to promote the best movement for their age. At 15 months old, children should be walking independently by now. They should be able to stand alone well without external support or handheld assist. They should be able to crawl upstairs 3 to 4 steps with supervision, of course. And they should be able to assume the standing position in the middle of the floor through a bear crawl position or using their hands on the floor to push up into standing without using any other supportive object. They should be able to squat down in play to pick up toys and then return to standing all on their own. They should be able to climb onto small objects or low furniture, such as a low couch, or like a step stool or something of that nature. Um, they should be able to throw objects with their hands while maintaining balance in the standing position. And in sitting, they should be able to use their hands or arms to gather a ball that would be rolled to them. At 18 months of age, we should be able to see them climb onto and off an adult-sized chair with supervision. They begin to walk up and down stairs, holding onto the railing or a parent's hand. They are able to seat themselves in a small pediatric-sized chair or toddler chair. They begin to use a ride-on toy by sitting on it and pushing the toy with their feet on the floor. They should be able to push and pull large toys around the room. And while walking, they should be able to carry a large toy well without losing their balance using both hands. They should be able to step on or kick a ball in attempt to imitate kicking as an adult would show them. They should be able to walk backwards at least 5 steps while pulling a toy on a string. And in standing, they should be able to throw a 6 to 8-inch ball using both hands in the forward direction. At 24 months, they are able to squat well to play with toys. So assume the squatting position and play in the squat for extended periods of time, get up, walk around, squat down again, etc. They should be able to run well without falling with their arms positioned at their sides. They should be able to walk upstairs by themselves with one hand on the railing or a wall and using both feet on each step. They should be able to walk downstairs with one hand on a railing or the wall with both feet on each step. They may need to use a parent's hand or an adult's hand descending steps, just for safety, and they're a little bit more fearful coming down than they are going up. Using either leg, they should be able to kick a ball about 3 feet forward without falling. And they should be able to push a seated ride-on toy with both feet on the floor. And this is just a toy without pedals. So they're just sitting on the toy and using their feet on the floor to make it go. They should be able to jump off the floor with both feet together and jump down from a height of 2 to 3 inches high. And while standing, they should be able to throw a tennis ball, size ball, overhand and underhand at least 3 feet. Okay, 30 months. They should attempt to imitate standing on one foot for 1 to 2 seconds at a time. They can walk on their tippy toes 5 steps and maintain balance while doing so. So it would be demonstrated by an adult, and you would ask them to walk on their tippy toes like a ballerina. Walking on tiptoes is not a normal way of walking, so I don't want anyone to get the idea that tiptoe walking is normal. But if asked to do so, they should be able to go up on their tiptoes and walk like a ballerina for 5 or more steps. They should be able to run 30 feet in 6 seconds or less. They should be able to walk up 4 steps, placing 1 foot on each step, so alternating their feet using the wall or a railing with one hand. And they should be able to jump down 10 to 12 inches with both feet together without losing balance. They should demonstrate swinging their arms in a rhythmic pattern when walking. And in standing, they should be able to throw a tennis ball overhand 5 to 7 feet by moving their arm up and backward like a baseball pitcher. In standing, yep. All right, nope, move on. Okay, so those are key pinpoint developmental milestones that we would expect those children at those ages to acquire. We're going to move on because a lot of children assume that this W sitting position that we want to inform parents about as well. This W sit position allows the children to feel stable when they're in play. It leaves their hands free to play without challenging their balance or their core strength. It also gives them a nice wide base of support when they're playing on the floor, which is why they like to do it. They may do this because they have low muscle tone, decreased sitting balance, or have too much mobility in their joints. This is a position that we don't encourage. So, the reason we don't encourage it is because too much time in this position can cause orthopedic problems and delay in development of their core strength and stability. It puts the hip joints in too much internal rotation, which tightens the inside of the leg muscles and stretches the outside of their leg muscles. This position, sitting in this position on the floor for extended periods of time, can lead to in-toeing gait or walking, or knock-kneed position walking, and it can affect their coordination, balance, and development of motor skills. So what can you do to help them? We want babies to be able to transition into and out of sitting on their bottom. So in a Taylor sitting position or crisscross applesauce position. So when you're discouraging the W sitting, you want to get on the floor with them and put their legs in front of them. And as you're doing that, give them the verbal cue. Fix your legs, sit on your bottom. One family told their little girl to sit pretty, which means we're going to sit on our bottom with our feet in front of us and not in a W position with our feet behind us. Okay, and when they learn to eventually do it on their own with your verbal cueing, just make sure you give them lots of praise, because then they'll understand the command and decrease the amount of time they're sitting in that W sit, which can be very detrimental. It can quickly become a habit, and it is important to correct at an early age to prevent any negative postural outcomes that may occur from this position. Okay, so if your child is not walking by 15 months, um, or if they walk with their toes turned out or turned in, if they seem to walk asymmetrically, or it looks like maybe they're limping, if they're walking on their tippy toes more than 25% of the time, those are some good things to talk to your pediatrician about and maybe get a referral for physical therapy. Um, if around the age of 2.5 years, they're not able to jump up off the ground, clearing the surface of the floor with 2 feet at the same time. If they just seem to be a little bit more clumsy or tripping and falling a lot as compared to some of their peers, if they neglect one side of their body, for example, if they always want to use one arm or one leg more than the opposite side, and if you go to pick them up and they just kind of feel kind of floppy and loose, or if they feel stiff when you pick them up. So those are just some red flags that you would want to discuss with your pediatrician, and potentially get a referral to physical therapy to kind of get an evaluation and make sure that there's not anything else going on that needs more attention. So if you have any questions, I'm happy to answer any questions right now, or we can save it until the end. If you think of a question, and you want to just put it into the chat, then we can address that at the end as well.
Okay, we will keep moving on, and then if there are any questions, again, feel free to comment in the chat and we will address those, or you can save them for the end.
Okay, so I'm going to talk about the occupational therapy section here. So, what is OT? We help promote engagement in daily occupations. And kids' occupations include eating, sleeping, exploring their environment, and very important, playing. So, anything that they want or need to do during their day. Okay, so for 1 and 2 year olds, important things to consider here. We are observing the child in their most comfortable environment. Usually that's home, could be grandparents' house, could be a daycare setting, wherever they are during their day. We're watching how all of the body systems interact, so vision, motor, and sensory. And we're looking at all areas of their development. So, what I look at as an occupational therapist, I'm looking at sensory integration, fine motor, visual motor, and self care. And we'll kind of get into all of those here. Okay, so for the sensory system, we are looking at tactile, so things that they are touching with hands, feet, different areas of their body. So vestibular, so this is motion, kind of changes in head positioning. Auditory, hearing, visual, their vision, obviously. Proprioceptive, so the muscle and joint sensation and knowing where their body is in space. Gustatory is taste, and olfactory is smell. So for tactile and touch, we really want to monitor any oversensitivity in all of these areas. So are they over responding in any one of these areas? So for tactile, we want to provide lots of opportunities to explore. So this is sensory play. And with this age, we really need to be aware of them putting things in their mouth. So water is a great one. You can look up a lot of taste safe things. There are recipes for taste safe paint. For sand, if they're putting sand in their mouth, you could use like crushed up graham crackers. So really looking at taste safe things is important here. But if they're not putting things in their mouth, other things like grass, leaves, sand, dry rice is great to work on that sensory play. For auditory, in vision, we're looking again if they're over responding to anything here, or on the other side, if they're having a lack of reaction, if they're not responding to any loud noises, or if they're over responding to loud noises, always covering their ears. If it's just kind of like a one off thing and they're covering their ears, not a huge deal. But if it's something that they're doing all the time, for gustatory, that's taste again. We're looking if they're overly sensitive to any tastes or different textures in their mouth, if they have a heightened gag reflex, or if they're eating a limited number of foods. For proprioceptive, are they constantly on the go? They're 1 and 2 here, so their attention should not be super long. But if they can't even sit and attend for a little bit to a toy, or to interact with you, if they're constantly on the go, that's something we want to monitor. If they're crashing into things and don't seem to know where their body is in space, if they're super clumsy, again, they're going to be clumsy anyway, but if it's something that they're really, really clumsy, something to monitor. We want to provide opportunities for heavy work here throughout the day. So, pushing things, pulling, lifting, hanging, crashing, all of those big, gross motor body movements. For vestibular, we want to monitor if they're scared of movement, if they're scared of, having their feet off of the ground, if they're seeking excessive movement or spinning and they never seem to get dizzy. We also want to provide opportunities for that kind of movement, swinging, rolling, climbing, using a scooter, using a bike, being at the playground, swinging on swings, climbing up the slide, going down the slide. We want to provide lots of opportunity for that movement. So at 15 months, these are just like some milestones that we can look out for. So they're stacking a 2 to 3 cube tower. They have a good pincer grasp. So that's that pinch with their thumb and their index finger. Are they pointing with their pointer finger? Imitating scribbling. So you're scribbling first, and then they're able to imitate you doing that. They're placing cubes into a cup or large pegs into a pegboard. They're imitating you doing pat a cake. So for self-care and feeding, drinking from an open cup, this will be pretty messy, but they can hold the cup, bring it to their mouth, have that motion, and can get most of it in their mouth. Using a spoon with assistance, chewing foods well. Foods at this point are still very soft. You want to make sure that you're able to squish them between your fingers to make sure that they're safe for them. But they're chewing them well. They're eating a variety of texture. So coarsely chopped food, soft meats, they're removing their socks. And when you are putting a shirt on for them, they're helping put arms through, pants, they're helping put their feet and legs through. 18 months, they're able to insert 2 shapes into a puzzle or a shape sorter. They're holding their crayon with a fisted position. So something like this, where thumb is up. They're picking up small objects, again, using that pincer grasp, and they're able to place them into a container. So, for instance, like if they're eating puffs or those yogurt melts, they're able to pick them up, can put them back in the container, feed them to themselves. They're using 2 hands together at the center of their body. So, holding something and walking with 2 hands, or they're able to support something and then play with the other hand. They're using two hands for different functions. For dressing, again, they're still assisting with dressing. They're pushing arms through, pushing legs through. They may begin to undress themselves. We're not seeing them, do zippers or buttons at this point, but able to pull off some loosely fitting pants or a loosely fitting shirt. They're beginning to put a coat on, they're pushing arms through. Maybe if you're holding it up, they're able to put their arms through. They attempt to put their shoes on, maybe like Crocs or something like that. We're not expecting them to put tight tennis shoes on, but maybe a slip-on shoe at this point. For feeding, they're drinking from a straw. They're using their spoon independently with some spilling. Again, if you're serving them soup, it's going to be very messy. But if they're eating something like applesauce or yogurt, something that sticks to that spoon, they're able to do it pretty independently. They're chewing with a rotary jaw movement, like how you or I might chew. So we're chewing and our jaw is going in that circular pattern. For grooming, they're attempting to wash during bathing. You're doing most of the washing for hygiene at this point, but they're imitating you, kind of bringing that washcloth all over, maybe pouring water over their heads. Um, they may show discomfort with soiled diapers. So they're, pointing to their diaper, maybe telling you that they peed or pooped. And they're sitting on a toilet with supervision. And they may begin some toilet training. Mostly if it would be imitating you at this point. Okay, for social emotional skills at 18 months, they're demonstrating self-assertion. So they're people now, right? They're expressing their wants, needs, and emotions. They want control over kind of what they're doing, whether you like it or not. They're imitating you doing chores. So, like in this picture, they get out their toy vacuum and they're imitating you there. They might be playing in their kitchen and imitate you cooking. They engage in symbolic play. So they're using toys or objects to represent something else. They're starting to have an imagination and do pretend play. They also engage in solitary play. So they're playing alone, getting that independent play, and they might still be uninterested in what others are doing around them. Or they have on-look behaviors and they're observing other people play. So again, these pencil grasps. So 18 to 24 months, you have that gross grasp, like this, and then when you're more two and a half year range, you have a digital pronate grasp. So your index finger is pointed towards the paper, and they're scribbling more like this. Okay, so for a 2-year-old, they start stacking up to 6 blocks, and then they can insert 3 shapes into a puzzle or sorter. They begin to hold a crayon or marker with their thumb and fingers pointed towards the paper, kind of just how I showed you like this, and they're scribbling like this. They're imitating a vertical stroke with a crayon or a marker. So you're doing the vertical stroke first, and then they are imitating you doing it. They're doing some circular scribbling. They're beginning to color within the limits of the paper. So they notice that there's a paper, there's a picture on the paper, they're scribbling, near that, not completely coloring within the lines, but they know there's paper and they know that's a limit for them. They're learning to open and close scissors and begin to snip randomly on paper. Again, this won't be too coordinated, but maybe imitating you doing it. They can string a 1-inch bead. They're putting blocks into a large hole and they're placing rings onto a ring stacker. For dressing, they are pulling off their shoes and unfastening clothing. They're unzipping a zipper. They're helping pull down pants, during diaper changes or if you're venturing into potty training at this point. They're finding arms in pullover garments. So, really helping you at this point, doing a little more of the work as far as dressing goes. With feeding, they're using a spoon more independently, less spillage, can maybe handle more of those like loose, soupy textures. Sorry, I feel my throat getting dry. They're biting. Sorry. They're, hold on. They're biting solid foods. They're using a fork with help, and the caregiver helps to load it. So you're loading the fork for them, and they're able to bring it to their mouths without a lot of spillage, and they're pretty accurate with getting that to their mouth. So for social emotional skills, they begin to show concern for other people's feelings. You're sad, sister's sad. They might come over to you, hug you. They're really curious as to what's going on. They're becoming easily frustrated. They're jealous of attention to others, so might be jealous of sibling or, somebody else that mom or dad is interacting with. They're initiating and responding to interaction with others. They're initiating separation, but they look for reassurance for you. They want to make sure that you're still there, that you're watching. They're showing trust and an attachment to you. So again, they might have that separation anxiety because they want to be near you, want to make sure you're there. They may begin to engage in parallel play. So they're playing in their own space with their own toys, but someone nearby of a similar age, is playing near them. Okay, so 2.5-year-olds, they begin to open and close and snip with scissors. A little more precision here. Again, they might be imitating what you're doing, but it's a little more precise. They begin to imitate simple block designs. So if you have like two blocks at the bottom and one on top, so creating a bridge, they're able to imitate that. They're stacking up to 8 cubes. They're turning pages in a book. They begin to string 1-inch beads. They're imitating a horizontal stroke at this point. So you make a horizontal stroke and then they're able to imitate it. For dressing, they're putting on shoes. We're not expecting them to orient right and left at this point, but they're putting on their shoes. They are dressing with assistance, undressing with some help only for fasteners. So that's your snaps, your buttons, your zippers, ties. They're putting on a front coat or shirt. They're insisting and pulling on socks. They're washing their hands with assistance. And for feeding, they're using their cup independently, sucking through a straw very easily at this point, and chewing like more resistive foods like meats and raw vegetables. So social emotional skills at this point, they're beginning to show interest in helping. Again, they might be imitating you more with the chores around the house, want to help you bring groceries in. They're beginning to describe their feelings: sad, mad, funny. They're talking about how others are feeling. They're watching a television show, Bluey looks sad, or they're talking about how, sister is feeling or people at daycare are feeling. They start talking about roles at this point too. So some red flags when you're looking at fine motor development. By 18 months, we want them to be, using that pincer. So if they're not able to use that pincer, pick up things on their tray to feed themselves. If they're unable to point at things with their pointer, or they're not able to use both hands during play. Those are some things that we want to look out for and maybe mention to our pediatrician. By 2 years, if they're not imitating you drawing that vertical line, if they're still mouthing a lot of things, putting a lot of things in their mouth, we want to watch out for that. If they're unable to put, a large puzzle piece into a board or a simple shape into a shape sorter, if they're not feeding themselves with a spoon, or if they're not stacking 2 to 3 blocks, we want to look out for them. By 3 years, if they're unable to imitate you drawing that horizontal line or those circular strokes, if they're unable to turn pages in a book, if they are unable to cut across a paper, to cut that paper in half, or if they're unable to catch a large ball thrown close by, those are things that we might want to mention to our pediatrician. Okay, so for 18 months, if they're unable to feed themselves with their fingers, or if they're unable to drink from a regular cup if held for them. By 2 years, if they are not using a spoon independently or a fork with help. So, again, if you're loading that fork, if they're not able to bring it to their mouth on their own. If they're unable to help with dressing, so if they're not taking off socks or shoes, if they're not pulling down their pants or helping find their armholes. By 3 years old, if they're unable to dress with supervision or undress with help only for fasteners. If they're unable to use a fork with increased independence, so they're starting to stab that food, on their plate or on their tray. If they're not toilet trained or not kind of moving in that direction, or if they are not independent with cup drinking or straw drinking, then we want to mention those things to our pediatrician. Okay, so for feeding, we want our kids to get messy, right? I know it's hard. I know it's just another thing you have to clean, but it's really important that they're touching things with their hands and they're getting their faces messy. It's all part of that feeding development. and we want to introduce a variety of foods. So the biggest thing I say with feeding is you have to try again. Be consistent. It might take up to 20 times for a food to be presented to a child, for them to decide to taste it. So just be consistent, try. You want to offer different colors, different textures, different consistencies. Encourage them to play with their food. Again, get them messy. And it's also important to have family dinner time. I know it's not always feasible with schedules, and kids might have early bedtimes and parents aren't getting home from work until late. But try at least 1 to 2 nights a week, to sit down and have a family dinner together. That's when your child is getting the sights and the smells, and they're watching you eat those different foods. So it's important with their feeding development. Okay, so with feeding, when is it important to seek more help, to talk to your pediatrician? If you're noticing your child has poor positioning during feeding, they're always slouching over, they don't have a nice upright alignment, which is very important. If they're frequently choking or gagging, if they have frequent pneumonia, that can show us that there's something going on with their feeding and getting food in their airway. If they are having trouble chewing or munching, if they're refusing certain consistencies or textures, and this is more around 12 months, if you're noticing that. If they have extended meal times, whether that be because of poor attention or they just really aren't interested in the solids that you're offering, or if they need increased time to, chew and manage that food, or if they have poor weight gain. Those are some signs that you want to talk to your pediatrician about your child's feeding. All right, does anybody have any questions about any of that? You can unmute or you can just put it in the chat.
Okay, we will keep moving on. And again, at any point, if you have questions, feel free to type them in the chat and we will address questions again at the end of our next section.
Okay, so before we get to the speech and language portion, we're going to talk briefly about some screen time facts. There's some research to show that 64% of toddlers aged 1 and 2 watch TV and videos over 2 hours per day, and 36% have a TV in their bedroom. 1 in 3 kids are using tablets or smartphones before they can even talk. Preschool age children spend an average of 4 hours per day using screen media, and 8 to 10-year-olds spend nearly 8 hours a day with screen media, while teens spend more than 11 hours per day. In terms of screen time, the American Academy of Pediatrics recommends 0 minutes of screen time for babies under 2 years old. However, by 1-year-old, 29% of babies are watching TV and videos for an average of 90 minutes per day. Screen time can undermine learning for babies, and 56% of parents of young children believe that baby videos are beneficial for their development. Some negatives of screen time, we're just, again, briefly going to mention the bullet points. Screen time negatively impacts children's and babies' sleep. It's a factor in childhood obesity, can promote mental health deficits, reduces their play opportunities. It hinders their interaction with others and their language skills, impairs their attention, and increases their impulsivity. So how does screen time hinder language? What it really does is limits our face-to-face interaction with caregivers, with all people. It limits the opportunities they have for talking to others and them listening to others. Babies become passive learners instead of active explorers of their own environment. It limits their creative play opportunities. It can limit babies' opportunities to use all of their senses for whole body learning. And digitally distracted parents, research shows that babies tend to show increased stress and anxiety symptoms when they're attempting to look at their parents or caregivers, and they are also distracted by technology. So a fair recommendation would be for every hour that a child does spend in front of a screen, he or she should be having an equal amount of time spent during non-screen play. This does not apply to babies or toddlers, as we are still discouraging screen time for all babies and toddlers under age 2. What parents can do is continue to read with your children daily, even at 7 months. You can start reading to them, and it's been known to be beneficial. Do your own research and choose programs and TV shows that are educational. You can watch TV with your child and talk about the show, talk about the characters, point out and label things that are seen on the screen. Be active while watching the TV together, dance, and talk about the shows, and connect to what the child sees on the TV to real life scenarios. Try to avoid using TV as a babysitter or to put the child to sleep, and turn off the TV when the shows ends. As we all know, Netflix and other programs just continue to add on when one is finished. Okay, so in terms of speech and language, speech refers to the sounds your child is making. And in infant, this would include cooing or babbling. For language, receptive language refers to how your child comprehends language, and expressive language is how they are using language. Comprehension of language would include understanding cause-effect relationships, following directions, understanding vocabulary words, and comprehending phrases or sentences used by their communication partners. Expressive language includes gestures, body language, vocalizations, words, sentence structures, and the ability to answer questions. Social emotional refers to how a child interacts with others. This includes joint attention, greeting others, their play skills, and how they engage with others. From the age level for 13 to 18 months, in terms of speech, they should be beginning to use jargon and making sounds that sound like sentences. They will be leaving off many final consonants and even some initial consonants. Their speech will be difficult to understand, with the exception of just a few words starting to emerge. They accurately can imitate some words. They're continuing to develop vowel sounds and diphthongs. Diphthongs are a combination of 2 vowel sounds. Kind of like an I is a combination of a I and an E, I. And they are varying their pitch when vocalizing. So they're experimenting with their voice and moving it up and down. In terms of language for 13 to 18 months, receptive language, they should be able to follow one-step commands with some gesture cues. If you're pointing to what they should be doing, that's a gesture cue. They should be able to identify at least 3 major body parts. They're beginning to give objects upon request. If you say, give that to me, or give it to daddy. Expressive language, they should be starting to use some true words within their jargon-like utterances. And they're combining their vocalizations with gestures to obtain a desired object. They will begin to using 3 to 20 single words, adding some new words each week. They are using words that are mostly nouns: ball, shoe. They are vocalizing with gestures, combining those 2. And they may begin to say all gone or all done, and requests more. For social skills and play for 13 to 18 months, they're beginning to give hugs and kisses. They're interacting in games with their parents. They're engaging in side-by-side play with peer, known as parallel play. They're starting to understand cause and effect, and they're also demonstrating relational play using 2 objects together. For 19 to 24 months, in terms of speech, they are going to be producing different consonant sounds. And these are some of the early consonant sounds that children will start to develop at this age range. These are the most common ones: the ba, the p, wa, ha, n, da, and ya. Receptive language for this age range, they're going to be able to identify several body parts now. They're following simple directions, which could be 1 and 2 step simple directions. They're beginning to understand some pronouns. They're identifying common objects and pictures when they are named, such as if you say, "Show me the dog," they're able to do that and point to the dog in the book. They are having emergent comprehension of some action words, such as go, eat, comprehending new words every day. Expressive language, they are spontaneously using about 10 to 20 words. They're attempting to imitate most words, and they're imitating some environmental sounds. That would consist of vehicle sounds, animal sounds, pouring water sounds, shh, things like that in play. By approximately 24 months, they should be starting to put some 2-word phrases together, such as "Hi, mama," or "more juice." They're beginning to protest "no," famous first word. They are able to use words more than gestures to communicate, and they may start referring to themselves by their own name. In terms of social skills and play, 19 to 24-month-olds should be spontaneously responding to greetings with a wave. They are liking to take things apart and play. They can stack rings, build some high towers. They can turn 1 page at a time in a book. They can activate mechanical toys and start some pretend play about familiar situations. Some red flags to consider for 13 to 24 months is if your child is not yet identifying body parts or any clothing items when asked, if they have minimal use of gestures such as clapping, waving, or pointing, they're not responding to greetings when someone says hi to them or goodbye to them, if they have difficulty identifying objects in pictures, or they're not yet utilizing true words consistently, more so than jargon or babble. For 24 to 30 months age range, receptive language is going to start consisting of following 2-step directions more consistently, such as "get the spoon" and "put it on the table." They're responding appropriately to location phrases and knowing the difference between "in" and "on." They're recognizing some family members' names. They're beginning to understand what and where questions, beginning to understand more verbs, beginning to understand complex sentences, such as "when we get to the store, I will buy you ice cream." For expressive language, the child should be generally speaking using 2-word phrases, and these will consist of nouns, actions, locations, and some beginning attributes. They're beginning to use first-person pronouns that refer to themselves, such as mine, I, or my. Beginning to answer and ask what, where, and who questions. They're using the word "and" in their phrases, "mommy and daddy," and they're beginning to use verb endings with the ing. 30 to 36 months for speech, we're going to see emergent use of some more consonants on top of the early ones we mentioned before, such as the k, g, t, d, and f sound. They speak with a loud voice, and they're increasing that range of pitch more frequently. They are consistently using initial consonants, even if it's not always the correct consonant, but still frequently omitting and substituting those final consonants. For 30 to 36 months, receptive language will be consisting of comprehension of most common verbs, comprehension of adjectives and emergent use, and comprehension of colors, shape, and size. They're beginning to comprehend quantity concepts, such as take just one of those or put the rest of them over here. They're beginning to comprehend location and preposition concepts, such as under or behind. Expressive language, they're starting to talk about things that are not in the room or something that happened when you weren't there at another location. They're continuing to increase that sentence length from 2 to 3 words or even more in one sentence. They're beginning to ask why questions or what happened. They're using consistent use of present progressive verbs, which is that verb with the ing ending, such as reading a book. They're consistently using regular plurals with the S on the end, and they're beginning to use prepositions in their speech, such as on, in, and under. For social skills and play, for 30 to 36 months, children will begin more pretend play and role play. They're beginning to play simple board games and other turn-taking games. They're going to begin to have some short conversations with other caregivers and talking back and forth more frequently. Some red flags to consider for 24 to 36 months is if your child has few consonants produced or they're missing many consonants in their speech. If your child is very difficult to understand. By age 3, you should be able to understand 75% of what they are saying. If your child is using gestures more often than words still to communicate, or they're not yet utilizing 2-word phrases consistently. If they're missing parts of speech, such as not using those pronouns or not using a variety of verbs, minimal labeling of objects, so they're not able to name them on command, or they're not able to follow directions, or they appear to not understand directions. Some things you can do to help your child's speech and language development would be to use short words and sentences when you are speaking. So you want to match your child and expand slowly, adding 1 word at a time when speaking. If they are regularly speaking using 2 words, use 2 and then expand with a third, such as if their child says pretty flower, you could say pretty big flower or pretty red flower. If your child is very difficult to understand, you can over-exaggerate your sounds and emphasize the part where they're having difficulty. For example, if they're saying pa for pop, you can really pronounce and exaggerate the final P, saying pop. You can read books daily and talk about all of the things in books with your child. Teach your child new words and expand their vocabulary by naming objects around you every day. You can play simple games. You can group objects into categories. You can give your child a choice of 2 options instead of always asking them a yes or no question. So instead of saying, do you want milk? You could ask them, do you want milk or water? This is something we do frequently in speech therapy. We offer choices a lot. You could also consider doing a preschool program or a structured program for ages 3 and older. If you're not familiar, there is an imagination library that you can sign up for free and receive free books to your home once a month. So you could follow this link and sign your child up, and you will get a free new book every month, I think up to the age of 5. And if anyone has any questions, you can type them in the chat, or you can feel free to unmute at this time.
Okay, so that concludes tonight's presentation. The therapist will remain on the call for the next few minutes in case anybody has any remaining questions. So again, please feel free to type them in the chat, or you can unmute yourself. Okay, we do have one question in the chat, so this is gonna go to Melanie. It says, anything to look out for a multi-language household?
I don't think there's anything different that I would recommend you look out for, that we've already discussed. I think a recommendation would be you can still have a bilingual household with a young one, but you want to make sure you're not switching back and forth too frequently between the two languages. So, have a conversation in English and then switch over to your other language and for a longer amount of time, if that makes sense, instead of switching back and forth.